I'm Natalie. I've been a patient of Dr. Shakir for numerous years, and I'm bipolar. And I've been really, really depressed for several months in a row, contemplating suicide. Really, really a bad position in my life. Because I let myself go and gain a lot of weight within 2 years. Dr. Shaky introduced me to TMS and the CMWL. I was pretty skeptical at the beginning, but decided to do something about me to try to get out of the position I was in. And we started TMS in the same time that CMWL actually. And immediately, well, actually not immediately, but at the beginning I was still skeptical about TMS, but I started to lose weight, and after a few treatments of the TMS, I noticed that I was able to rationalize my thought. I had a better interaction with my children. Losing weight also definitely gave me more energy as well as the TMS. I started to get out of the house and exercise every day, and little by little I noticed that I was improving, and I even started to laugh, which was really good. I was really, really suicidal, and in the same time I was willing to try to get some help. I had 2 kids and I wanted to do something about it, but I couldn't do it by myself. I was really, really deeply depressed. And when I started TMS, it was a big commitment. Coming every day was a big commitment. I live far away, but I was ready to do it. Dr. Shaky and his team really supported me in that effort, and that was really good. When you're depressed, it's really hard to move out of the house. The first time is quite impressive. There's a lot of measurement done, etc. But then you get used to it. The first 2 treatments, I didn't really think a lot about it. The 3rd day was a bad day for me. I came here and I was crying, and they were really supportive, told me to give it some time. And after, I would say maybe 5 to 7 treatments, I started to feel a difference. I was ready to go out. I was shopping again for the house. The fridge was full. Cooking for the kids. And they really noticed the difference of I was getting better and better. You couple that with the CMWL, it really helped me to eat better, to exercise, in addition of the TMS. I think the fact that I did both treatment in the same time definitely had a big impact of how I perceive myself first, and the treatment by itself with the TMS. I don't know, it was within 3 weeks. I was so much better when I had been clinically depressed for months. At the end of the 4 weeks, I had several job interviews. I had few offers, and then I finished my treatment and I was ready to go back to work. I was feeling good about myself, physically, emotionally, and that was a big success. So when I started CMWL, that was mainly for a medical problem. I was obese. I just crossed the border of obese. I had cholesterol, low energy, and Dr. Shakir mentioned that program that they have, and I decided to go for it. And I did the meal replacement. The first few days were a little bit difficult, but I adjusted quite easily. It was easier than I thought, and it gave me more energy, of course. And I lost 17 pounds in 4 weeks, 5 weeks. I was exercising every day. I really liked the vanilla shake. I believe they were my favorites. I had some bars that I preferred, like the milk and cookie, the double chocolate, the peanut butter was really good. In terms of trying to think, it was mostly the vanilla product and this kind of bar that I really liked. I had some mocha drink as well, like really good. They are not filling me as much as the other products, so I tried to stick with the shake and the bars, and for me it worked really well, I think. So personally, I can say that the TMS work and the CMWL worked as well. Individually, I don't know what would have been the result. The fact that we did that integrated approach, I believe, was the best way to go. Depression will make you eat and gain weight. If you lose weight but you're still depressed, you're going to eat again. So I know that combining the both was really a success for me, and that's what I would definitely recommend to someone debating what to do. It's to go for both of it. That's personally what worked for me, and I believe that the outcome would have been different if I would have just like TMS or just CMWL.